So stitches in the left side increase by lying on the left side. Stitches left side, again bryonia in pleuritis, aggravation motion, bryonia. And there is calicarb also. With calicarb, we know the modalities are opposite for calicarb, which we studied before. In tuberculosis, it is oftenest indicated in the incipient stage with the symptom of cough, oppression, and general weakness already mentioned. But I have often found it indicated in the later stages, and if given very high and in the single dose and not repeated, have seen it greatly benefit even in curable cases. If given too low and repeated, it will fearfully aggravate. One of the most characteristic symptoms of this remedy is feeling of intense heat running up the back. Again, the burning may be in spots along the spine. Also, it has intense heat and burning between the scapulae. See also lycopodium. These, like the rest of the burnings of phosphorus, often occur in diseases of the spine and nervous system, but not necessarily so. Like zinc, these burnings may be purely subjective, but are nonetheless valuable as therapeutic indications. Another very characteristic symptom of phosphorus is burning of the hands. It is as strong as the burning feet of sulfur. Sulfur has burning feet and phosphorus has burning hands. Remember this. It's very useful because particularly in diabetic nephropathy, you will get these burnings. And if you have really strong burning in the feet, sulfur is often indicated and cures if it is indicated. I have seen cures in the sense of, the burning is entirely gone and is found both in acute and chronic diseases, cannot bear to have the hands covered. The flashes of heat all over which phosphorus has begin in the hands and spread from there even to the face. It now remains to call attention to the constitution of phosphorus. Tall, slender patients of sanguine temperament, fair skin, blonde or red hair, quick, lively perception, and sensitive nature. That is one constitution. Constitution 2, tall, slender, thigh-sickle patients, delicate eyelashes, soft hair. Constitution 3, tall, slender women disposed to stoop. Constitution 4, young people who grow too rapidly and are inclined to stoop. Constitution 5, nervous, weak persons who like to be magnetized. Now in number 4, there is not the tendency to grow fat like calcarea corp, but tall, and you will notice that the phosphorus element in Calcarea phosphorica takes away the fat-producing property of the Calcarea element. Calcarea phos is generally thin. Now, in closing, we desire to say we have only touched upon the wonderful virtues of this drug, which must be studied in its entirety. Enough, however, we trust to convince of its great value. So what are the most significant things that we learned? The first thing, as I told you, was about the empty feeling, empty, faint, sinking feeling in head, chest, stomach, and whole abdominal cavity. And then the next is burnings are prominent in every place. And then, so these are the two main sensations. One is the empty feeling and the other is burning. If you cannot remember many things, you at least have to remember these things as we recap. And then we have cough, which is increased in the evening time, and right lower lobe is mostly affected. If there is stitches in the left side, they are aggravated by lying on the left side. Lying on the left side aggravates the condition. Cold aggravates the condition. Speaking, talking, laughing aggravate the condition. And larynx is so painful is painful that the patient cannot talk. They would prefer not to talk. And then we have cold aggravation, but craving for cold things. The patient ice creams, like Donald Trump, he loves ice creams. Donald Trump's favorite food, favorite dessert is ice cream. So he's also like a phosphorus. He just diffuses, right? When he speaks in common man's words. Anybody can resonate with him. The patient is chilly and he likes cold things like ice cream, cold water. Cold water usually does not agree. The patient vomits the cold water. It happens usually in ulcers and GERD. There's a lot of hunger, gets up in the night to eat. The patient's all the time anxious and restlessness throughout. It's not just hands or feet, it's all over. And sometimes goes into a state where the patient is apathetic, unwilling to talk, answers slowly, and moves sluggishly. So these two stages are there. In the beginning, they would be anxious and restless. But towards the end, when the disease increases or when the pathology appears, they would become apathetic and unwilling to talk. And then we mentioned how the stool is very characteristic in constipation, long, dry, tough, hard, like a dog stool, and is voided with pain. Sometimes there is hemorrhagic tendency. Hemorrhoids, if they are there, they would bleed, bright red blood. And then if there is diarrhea, it is like pouring out as from a hydrant, and the anus seems wide open. There's no control, it's just going, diffusing. And then the patient has bleeding tendencies. Small wounds bleed much. If the menses doesn't happen, there will be vicarious bleeding from nose, stomach, anus, urethra. And if the patient has any lung disease, hemoptysis, if has any running nose, then tendency to epistaxis. This is what phosphorus is all about pathologically. Now I would like to read the rest of the phosphorus from George Vetolkas, which is very useful, which would be a revision for many of us. So, as I said, he describes the patient as somebody who diffuses into the environment like the color from a tea bag diffuses uniformly into water. Let us describe a person in a healthy state who nevertheless possesses the phosphorus predilection, which can emerge into a disease stage if the defense mechanism becomes overwhelmed by too much stress. In doing so, however, keep in mind that we only prescribe on the pathological symptoms, not on the healthy ones. The phosphorus patient physically is usually lean, tall, and delicate in features, hair, skin, and hands. Now we can see the young Donald Trump, lean, tall, delicate in features, hair, skin, and hands. As a child, this person is warm, outgoing, affectionate, artistic, or musical, and very sensitive. Artistic is something that you need to keep in mind. Phosphorus is generally artistic. I remember some of my friends in college who were very artistic and tall and slender, artistic, and these guys, they had this effervescence, this diffusive tendency about them. They would just go out, they would just reach out. If there is any person in distress, if there is any person who needs, they would somehow find it out and they would reach there. Somehow. I didn't have that ability to reach out to people finding who has a difficulty, but they had this ability, and they were artistic also. So I think, they could have been phosphorus. The child is very open and impressionable. One can see through such a child, whose being is effortlessly manifested without much reserve. Unreserved. Opposite is natremia. Natremia is always reserved. They would not let you know what is going on inside. Phosphorus is like an open book. They would let you know what is going on inside them. If they are tormented, they would say, I'm tormented, I feel tormented. If they feel calm, they would be very happy. You can just see the person and know that the person is who they are. That is phosphorus. When in health. During adolescence, there is tremendous growth spurt which leads to a typically lean, lanky appearance. Throughout life, the phosphorus type person is a warm, friendly extrovert who enjoys friendship and company very much, but also may enjoy solitude to pursue artistic endeavors. Now, it is to pursue artistic endeavors that they prefer some solitude in their life. Such a person is enjoyable to have around because he or she is truly sympathetic, freely putting the interests of friends above personal concerns. Have you seen such guys, who are just so friendly that they would forget about themselves? Now, in Three Idiots, we have that character of Amir Khan. So he has an examination to take the next day, but he's concerned about his friend's father's sickness, who is like about to die, and he takes a scooter of his professor and he dangerously, so that is phosphorus. He takes that patient to the hospital and takes that scooter inside the hospital, and he just meets the need, and he puts the interests of his friends above personal concerns. So the next day he has exam, but he's not concerned about those things. He's more concerned about his relationships with his friends. So these are usually people-oriented people, not task-oriented people. The task is fulfilled or not doesn't affect phosphorus so much. I'm a task-oriented person, so if I don't fulfill a task correctly, I would always feel uneasy about it. So this is more like the opposite of who I am, like where tasks are less significant, less important than people. That is where we all want to be. We all want to be sensitive, more sensitive to people, more people-oriented if we are ministers of the gospel. But not everyone is like that. It is our personality. So phosphorus, if you look at the Myers-Briggs, phosphorus would be always E, extrovert, and perhaps N, E-N, and F, E-N-F, and P maybe, but we do not know. S or E-S is also possible, E-S or N, and F. The phosphorus person is highly intelligent and refined. Refined means their behavior is very refined, very sophisticated. There are no secrets for such a person. Whatever is on his mind, he shares freely. Warmth and affection diffuse freely towards friends and even strangers. Much of his or her life revolves around interpersonal relationships. Such a person makes a good politician, the type that pushes for humanitarian causes. Or a phosphorus type may become a sales agent because he has the ability to sell anything he believes in. We find both these abilities in Donald Trump. I find these abilities in my father, who was a businessman, a salesman. And he used to say a salesman must first be able to sell himself, which I'm not good at. My father is not a politician, but I'm saying that if there are people which I mentioned, like Uman Chandi and others, they are good politicians. They just feel the pain of others, empathetic people. And I believe that they have affinity towards the phosphorus type. The phosphorus person is very impressionable and will believe anything which is told to him in an area outside of his own competence. That is also significant. They would believe anything which is told to him in an area outside of his own competence. Now we know certain things that Donald Trump would say which are outside his own competence. He would just quote somebody else and he believes that they are speaking the truth. He doesn't go into the depths of it to understand it, but he just believes, he accepts it as a truth. So this is what happens to many of us if we have this phosphorus nature, where where people are very impressionable and quickly believe, quickly accept something that is not